This is a PowerPoint about a genetic disorder called Waardenberg syndrome. It has been completed by nursing students including Lauren Griggs, Caitlin Moss, Allison Simpkins, and Beulah Barlow. Waardenberg syndrome is a genetic disorder that is passed down from parent to child just like other genetic traits such as hair color or blood type. It is a dominant gene which requires only one parent to have the mutation in order to pass it down to the child. There are 4 kinds of Waardenberg syndrome, but the most common is type 1 and 2. Every case of Waardenberg syndrome is different, and its variation of hearing loss and skin and hair pigmentation changes. Depending on the person and type of Waardenberg syndrome, a person can have physical traits including patches of white or gray hair, wide-set eyes, low frontal hairline, connecting eyebrows, or moderate to severe hearing loss. 2 differently colored eyes, such as one blue and one green, are sometimes seen in Waardenberg syndrome. Another characteristic is 2 brilliantly colored blue eyes. Other than physical characteristics, genetic testing to check for the mutation, and hearing tests to diagnose deafness or hearing loss, there are no other tests to diagnose Waardenberg syndrome. Other possible symptoms of Waardenberg syndrome include constipation, pale-colored skin, difficulty completely straightening joints, a slight decrease in intellectual function, or a cleft lip. Since every case of Waardenberg syndrome is different, you may see all or none of these characteristics. There are a few potential complications for a person with Waardenberg syndrome depending on the type and severity of their disorder. Severe constipation could lead to the need to remove part of the large bowel. Other potential complications include hearing loss, self-esteem problems, slight decrease in intellectual function, and a slightly increased risk for developing a muscle tumor called rhabdomyosarcoma. There is no specific treatment for Waardenberg syndrome. The treatment plan for an individual with this syndrome depends on what specific problems they are encountering. For example, if a person struggles with constipation, they might be advised to maintain a diet that encourages proper bowel function, as well as medications to increase bowel motility. Other than symptom treatment, normal life is expected for someone with Waardenberg syndrome. There may be some cases that a person experiences more rare and severe complications that lead them to a more complex treatment regimen. In general, this is not a life-threatening disorder.
A colon biopsy may also be done to detect any problems of the bowel. This will require a bowel preparation to cleanse the bowel before the procedure. During the procedure, the doctor will insert a scope into the rectum and remove any polyps. These polyps will then be tested for signs of cancer. A bowel transit test may be used to determine any colon problems often associated with Waardenberg's. The patient will swallow 2 capsules filled with food dye and record how long it takes the first colored dye to appear and then the second. If it takes 72 hours or more, it may indicate a slowed bowel function. While there is no direct link between Waardenberg's and mental disabilities, it is a possibility an assessment of developmental status may be done by the nurse. Physical characteristics of this syndrome include pale eyes and gray patches of hair. It is important to talk to the patient about their body image and help them work through any issues they may have. If there is profound hearing loss from birth, a speech pathologist may be needed to help teach the child to speak. Some patients with Waardenberg's may also be born with a cleft lip. This could be addressed by a speech pathologist as well. As mentioned earlier, bowel problems are often present and a specific diet may need to be established for these patients. A nutrition consult would be appropriate. It is important to educate the family on this syndrome and to answer any questions they may have. If auditory disabilities are profound enough, sign language may need to be learned. This would be another opportunity to educate not only the patient but the family as well. Pale skin is associated with Waardenberg's, and patients need to wear sunscreen and be educated about proper sun protection to prevent sunburns and possible skin cancer. As mentioned before, it is important for the nurse to give the patient and family access to appropriate resources such as physical therapy and nutrition consult information.
Severity and presence of symptoms depends on the type of Waardenberg syndrome an individual has and what treatment they received as infants. In type 1 or 2 Waardenberg syndrome, they have the classic symptoms discussed above. deafness, color abnormalities in hair and eyes, and a slight chance of intellectual issues. Caregivers and the family will probably have to learn sign language if deafness was not able to be corrected in infancy. Children with Waardenburg syndrome will have very distinctive coloring, either in their eyes, their hair, or their skin. This could attract lots of attention and require lots of explaining by parents and the children themselves. Type 3 Waardenburg syndrome, or Klein-Waardenburg syndrome, is associated with musculoskeletal abnormalities, usually upper limb abnormalities. If a child has type 3 Waardenburg syndrome, they will probably have to have physical therapy or use some sort of assistive device. Type 4 Waardenburg syndrome, or Shaw-Waardenburg syndrome, has the additional symptom of Hirschsprung syndrome. Hirschsprung syndrome is the lack of innervation of a section of bowel and is often diagnosed as a newborn. Children with Hirschsprung will have to have corrective surgery early in life and may have continuing issues with bowel motility or constipation.
Some tips for caregivers. Caregivers should participate in respite care because respite care can help the caregiver avoid feelings of frustration, and while they won't be under continuous stress, they will better be able to function whenever they are providing care. It's also better for the client to be able to function with numerous people and have some independence, and respite care allows her to meet and become friends with new people. Support systems are also good. They give someone for the caregiver to talk to that will understand whatever it is that they're feeling and help them channel any feelings into something positive and understand that sometimes these feelings are normal. Whenever they are providing care for the client, they need to maintain conversation. The client may have social anxieties and they will show stress through behaviors such as jerking and hand motions, which can be stopped through continuous conversations and distractions. The caregiver should also encourage independence in the client because they are capable of performing many tasks alone, and some tasks they may only need someone to remind them or prompt them in what to do. They should be encouraged and allowed to do as much as they can for themselves. Alternative teaching methods from caregivers may come in the form of when you're telling time or with recipes. This will depend on the level of intellectual functioning that maybe needs to be adjusted depending upon that. They may have clocks that can have the minutes wrote out from them so that they know what the minutes and the hours are as pictured on the slide. And they may also need recipes that have pictures instead of written ingredients to make up with any deficits in reading. Schedules, they may have a routine that helps them stay on track and on time throughout the day, so any schedule changes should be clearly communicated, and whenever possible, the client should be the one to make the decision on how to change the schedule so that they can still maintain some independence.